Welcome to another episode from the Veterinary Research Channel. Today, we delve into a critical health concern affecting our canine companions, heatstroke. This life-threatening condition, characterized by a dangerously elevated core body temperature, specifically exceeding 41 degrees Celsius or 108.5 degrees Fahrenheit in dogs, often presents with signs of central nervous system dysfunction. Extreme overheating sets off a cascade of damage throughout the body's tissues, leading to a variety of clinical and pathological syndromes with differing degrees of severity and rates of progression. Despite our best efforts with whole-body cooling and intensive supportive care, heatstroke in both humans and dogs remains highly fatal, with mortality rates sometimes exceeding 50%. Improving the outcomes for these patients hinges on early diagnosis, the identification of secondary complications, and prompt intervention. One of the significant complications observed in over half of dogs suffering from naturally occurring heatstroke is a condition called disseminated intravascular coagulation, often referred to as DIC. This serious condition is strongly linked to a higher risk of death. Post-mortem examinations of dogs that succumb to heatstroke have revealed tissue damage consistent with disseminated intravascular coagulation, including injury to the lining of blood vessels, neutrophilic inflammation, widespread cell death, and the formation of small blood clots along with a tendency to hemorrhage. While standard blood tests that measure clotting factors and platelet counts are crucial in diagnosing disseminated intravascular coagulation, these tests might not always provide a complete picture of the overall hemostatic, or blood clotting, process. They may not fully assist in making immediate treatment decisions, such as whether to administer fresh frozen plasma or anticoagulants, especially in the early stages of disseminated intravascular coagulation when it might be hypercoagulable and not yet overtly apparent. Viscoelastic tests, like Thromboelastometry, offer a more comprehensive assessment of global hemostasis. These tests evaluate the entire clotting process, from the initial formation of a clot to its eventual breakdown, and have been previously validated for use in dogs. The growing interest in viscoelastic testing in veterinary medicine stems from its potential to better predict whether a patient is at risk of forming blood clots or experiencing bleeding, and to help determine their coagulation status when disseminated intravascular coagulation is suspected. This brings us to the study we will be discussing today. The primary goal of this research was to evaluate the diagnostic and prognostic value of thromboelastometry in dogs with heatstroke. A secondary aim was to describe how blood clotting abnormalities change over time in these dogs and to determine if these changes are associated with illness severity and the likelihood of survival. The researchers hypothesized that certain blood clotting measurements and thromboelastometry variables, tracked over time, could serve as predictors of outcome. They also proposed that thromboelastometry would be a useful tool in characterizing the specific type of coagulation disorder present in dogs with naturally occurring heatstroke. Now, let's move on to the findings of this study. The research team enrolled 42 client-owned dogs that were diagnosed with naturally occurring heatstroke at a veterinary teaching hospital between July 2017 and November 2020. Heatstroke was diagnosed based on a sudden onset of clinical signs consistent with the condition in otherwise healthy dogs following strenuous exercise or exposure to high environmental temperatures. Dogs with pre-existing kidney or heart issues, those receiving medications that could affect blood clotting, and dogs whose owners declined treatment for financial reasons were excluded from the study. The overall in-hospital case fatality rate in this group of dogs was 31%. The researchers observed that several clinical signs at the time of presentation were associated with a higher risk of death. These included collapse before arriving at the hospital, an inability to walk, the presence of shock, and increased effort in breathing. Interestingly, the time interval between the heat exposure and arrival at the veterinary hospital was longer in the dogs that did not survive compared to those that did. Looking at blood work results, the researchers found that at 12 to 24 hours after presentation, dogs that did not survive had lower levels of hematocrit, packed cell volume, and total plasma protein compared to the survivors. Several serum chemistry markers measured at the time of presentation were also higher in the non-survivor group, including alanine transaminase, aspartate transaminase, creatine kinase, alkaline phosphatase, and gamma-glutamyl transpeptidase. Additionally, the serum creatinine concentration, a marker of kidney function, was higher at presentation and at 12 to 24 hours after presentation in the dogs that did not survive. Serum potassium levels at presentation were also higher in the non-survivor group. When examining standard blood clotting tests, the study found that prolonged prothrombin time and activated partial thromboplastin time, both indicators of slower blood clotting, were more common in the non-survivor group at presentation and at 12 to 24 hours after presentation. Dogs that did not survive also had lower antithrombin activity and fibrinogen concentration, and higher D-dimer concentration at 12 to 24 hours after presentation, all of which are markers related to coagulation and its breakdown. Now let's focus on the thromboelastometry findings. The intrinsic thromboelastometry clotting time was longer, and the alpha angle, maximum clot firmness, and maximum lysis were lower in the dogs that did not survive compared to the survivors, at presentation or within the first 48 hours of hospitalization. Lower maximum lysis on extrinsic thromboelastometry at 12 to 24 hours after presentation was the only significant difference observed with this test between the two groups. Based on the area under the curve measurements from both intrinsic and extrinsic thromboelastometry, most dogs were classified as having normal coagulation at presentation, but shifted towards a hypocoagulable state, meaning their blood was less able to clot effectively, at 12 to 24 hours after presentation. Notably, a hypocoagulable phenotype on intrinsic thromboelastometry was more frequently observed at presentation and at 12 to 24 hours after presentation in the dogs that did not survive compared to those that did. The study also looked at secondary complications. Acute kidney injury occurred in a large majority of the dogs and was more frequent in the non-survivor group. Dogs with a hypocoagulable result on intrinsic thromboelastometry at 12 to 24 hours after presentation were more likely to develop acute kidney injury. Disseminated intravascular coagulation, diagnosed based on the results of standard blood clotting tests, was more common in the non-survivor group and was also more frequent in dogs with a hypocoagulable phenotype on intrinsic thromboelastometry at all measured time points. Finally, the heatstroke severity score, which combines various clinical and laboratory findings, was significantly higher in the dogs that did not survive and was also higher in dogs with a hypocoagulable result on intrinsic thromboelastometry at the time of presentation. Moving on to the discussion of these results, this study provides a comprehensive evaluation of the hemostatic status of dogs with naturally occurring heatstroke, utilizing both traditional blood tests and thromboelastometry. The findings highlight that dogs with heatstroke experience significant blood clotting abnormalities, which are more pronounced than those that do not survive. The association of prolonged clotting times, both prothrombin time and activated partial thromboplastin time, with mortality, even early in the course of the illness, supports previous research. Abnormalities in fibrinogen and D-dimer levels, as well as antithrombin activity, were also linked to death, particularly at 12 to 24 hours after presentation. The occurrence of disseminated intravascular coagulation, based on standard blood tests, was common in this study and was associated with a higher risk of death, aligning with prior findings in dogs and humans. Importantly, thromboelastometry, especially the intrinsic test, appears to be a valuable tool for assessing the coagulation status in these dogs. The study found that disseminated intravascular coagulation occurred more frequently in dogs displaying a hypocoagulable pattern on intrinsic thromboelastometry at all measured time points compared to those with normal coagulation. The majority of thromboelastometry abnormalities observed in this study indicated a tendency towards hypocoagulability, which was associated with a poorer outcome in dogs with heatstroke. This is consistent with findings in human heatstroke patients, where lower maximum clot firmness on thromboelastography has been linked to disseminated intravascular coagulation and mortality. The rapid transition from a potentially hypercoagulable state in early, non-overt disseminated intravascular coagulation to a normal coagulable and then hypocoagulable state, as suggested by the thromboelastometry results, has important implications for both treatment strategies and predicting patient outcomes. Similar to the trends seen in traditional coagulation tests, the significant differences in most thromboelastometry variables between survivors and non-survivors often became more apparent at the 12 to 24 hour mark after presentation. This suggests that even if initial hemostatic tests are not markedly abnormal, sequential monitoring of blood clotting function is crucial in dogs with heatstroke. The study also found correlations between traditional blood clotting tests and thromboelastometry results at presentation. For instance, prolonged prothrombin time and activated partial thromboplastin time were associated with hypocoagulability, which is consistent with the depletion of clotting factors and reduced liver production often seen in heatstroke. Higher fibrinogen levels in dogs with hypercoagulability could potentially serve as an early indicator of a tendency to form clots. Lower antithrombin activity and elevated D-dimer levels, suggesting reduced natural anticoagulation and increased clot breakdown, were also noted in hypercoagulable dogs. These findings underscore the value of using thromboelastometry alongside traditional tests, as they provide different yet complementary insights into the complex hemostatic changes occurring in heat stroke. While platelet count itself was not found to be associated with death in this study, marked reductions in platelet numbers were common in both survivor and non-survivor groups. Interestingly, survivors tended to have higher mean platelet volume and platelet crit, suggesting that the overall mass and function of platelets might be more important prognostic indicators than just the platelet count. This is supported by the lower maximum clot firmness observed on intrinsic thromboelastometry in non-survivors at 12 to 24 hours after presentation, as this measurement is influenced by platelet count, function, and their interaction with fibrin. The area under the curve from thromboelastometry, used in this study to define the overall coagulation status, showed similar trends to maximum clot firmness, even at the initial presentation. Other thromboelastometry abnormalities, such as prolonged clotting time and reduced alpha angle in non-survivors, further point towards decreased activity of coagulation factors and fibrinogen, aligning with the known mechanisms of heat stroke. The observation of a hypercoagulable phenotype on intrinsic thromboelastometry in a small percentage of dogs at presentation may reflect an early phase of increased clot formation in response to heat injury. However, the subsequent shift towards hypocoagulability in most dogs, coupled with clinical and laboratory signs of increased bleeding tendency in non-survivors, highlights the need for caution when considering the use of anticoagulants in these cases. The study also noted that liver enzyme activities were significantly higher in non-survivors, mirroring findings in human heat stroke patients, and suggesting that liver damage may worsen blood clotting abnormalities. Similarly, elevated muscle enzyme activity, particularly creatine kinase, in non-survivors aligns with observations in both canine and human heat stroke and indicates significant muscle damage. Acute kidney injury was a frequent complication in this study, affecting nearly 80% of all dogs and all of the non-survivors. The association of a hypocoagulable result on intrinsic thromboelastometry at 12 to 24 hours after presentation with the development of acute kidney injury suggests a potential link between coagulation abnormalities and kidney damage in heat stroke. Finally, the heat stroke severity score proved to be a valuable tool in assessing the severity of illness and predicting outcome in this group of dogs. The case fatality rate observed in this study was lower than in some previous reports, possibly due to variations in enrollment criteria, treatment protocols, and more intensive monitoring. Notably, a shorter time between the heat exposure and arrival at the veterinary hospital was associated with a higher chance of survival. The researchers acknowledged several limitations of their study, including the relatively small number of dogs enrolled and some missing data points, which limited the statistical analyses. They also did not specifically evaluate the impact of treatments like fresh frozen plasma on clotting test results and survival. Furthermore, certain advanced coagulation tests were not available for this study. The study was conducted at a single veterinary teaching hospital, so the findings may need to be applied cautiously in other settings. Finally, different analyzers were used for some measurements, which could have introduced some variability, although the researchers' experience suggests the results were comparable. In conclusion, this study demonstrates that thromboelastometry, particularly the intrinsic assay, is a useful tool for evaluating the coagulation status of dogs with heat stroke. The finding that hypocoagulability, as determined by the area under the curve on intrinsic thromboelastometry, is linked to a worse prognosis and a higher likelihood of developing disseminated intravascular coagulation and acute kidney injury underscores its potential clinical value in managing this challenging condition. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.